when we discharge them from the hospital and we see them in clinic, we have this expectation that they know their medications and their diseases and so forth. But when we formally ask the question, they often can't tell you what's going on. They don't even know why they're in the hospital. If you ask them other simple things, like to read a prescription label, many of them have problems with numeracy. Do you guys know what numeracy is? Numbers, knowing what a number is. So if you say you have a chance 1 in a million to get a side effect, some people will say, oh geez, then I don't want that, because they don't understand what a million is. Okay. So how we talk to them and how we know what they know is really a challenge. And as physicians and as nurses, pharmacists and so forth, the challenge is to figure out how to connect with them at their level to know what they know and teach them in a way that they can understand. So the first step in this is figuring out what they know. And so when you're thinking about the personal health record, this is a patient's document as opposed to our document. It's not we're broadcasting to them what we want them to do. Instead, it's the reverse. They're broadcasting to us what they think they're supposed to be doing and what they think they are doing. So in the context of a patient comes in with diabetes, and you're asking them now to start filling out a personal health record, what you're asking them to do is their opinion about this, not our opinion about what they're supposed to do, but their opinion about what they're doing. So if they don't know the answer, that's something the doc needs to know. Just if you write it in for them, won't teach the doc anything, because then the doc won't know what they don't know. So you want them to write it down. So you say, can you write down your medications? And if they write nothing down because they can't come up with it, it tells you that they're problem solving because they'll probably have somebody filled in their pocket who's pretty impaired. And that's worth knowing too. A lot of diabetics are cognitively impaired, and it might trickle down to things as simple as their medications. The second thing is so if they can write that down, you have 10 minutes, right? So the trick is to say, do you know what the side effects are? Do you know what this medicine is for? And if they know what it's for, that could be a diagnosis or a symptom. In the personal health record, you could then ask them to say, okay, why don't you write that, and you can guide them. It sounds like a diagnosis, or it sounds like a symptom, and those would be the red flags part. With as they do this, if the goal here is for you guys not to teach them what their disease is. The goal is to get them comfortable with saying things about their disease as they understand it in their own context, using their own words. So if they say they have high blood, it could mean for one patient it could be high blood pressure, and for the other one it might be high blood sugar. Depends on the patient, depends on the situation. It's useful to know that those are the words they use, and it's okay if they put those down. We as health professionals often use technical terms for things that patients couldn't possibly understand. An example would be CHF for heart failure. And then we go ahead and use the word heart failure when all the patient might understand is that they're breathless. They may not know that that's their heart, or they have swollen legs. They may not know that that's their heart either. And when they go home and you said, if your symptoms for your heart failure get any worse, then you should come in. But if they don't know that that's their legs or their breathing, then they wouldn't know to come in, and they'll end up in the ER. So how would we know the words that they use if we write down for them heart failure? So we wanted them to put the words that they use, that their drugs are for and the symptoms are for. And in the process you can say, are there any other conditions you have, anything else you're worried about? And they might actually uncover other things that they've had, a swollen toe. So the swollen toe is fine if that's what they call it. They might mean gout, and the doc wouldn't know that, and that was a priority for them unless you had them write it. So the art of this is getting them to write. And if you were also now the teacher of this, your goal would be to say, well, how often are you supposed to be taking your medication? Okay, write that down. And if they get it wrong, if they're now going into the doctor's office, you wouldn't want to fix it because the doctor would never know that they didn't know. Okay? So the personal health record is something that you want to have come back to the doc with all its warts and moles, with all the mistakes that they make, so that it becomes instructional for the provider to know what they're supposed to be teaching them. Now, as you see the mistakes they make and what they don't know, it should be instructive to you, because as you're learning this, you're discovering there's some patients that are going to be really good at this, but the vast majority have difficulty with lots of simple things. We did a study now 2.5 years ago where we asked the question, we showed a prescription label that said, take 2 at bedtime. And we asked the patients, this is Medicare fee-for-service patients in the hospital, we said, when are you supposed to take this medication? What percentage you think couldn't answer the question? Take 2 at bedtime. When are you supposed to take this medication? Over 40%. It's about as simple as a prescription gets, in a doctor's mind at least. Take one sometime would be even easier, I suppose. So we asked the same question, saying, well, these were old people, a little ageist comment there, in an OB hospital, and the problem was present in 45%. So it wasn't about being old. It's much worse than you can imagine. Now, you guys are all highly educated, so very few of you would have a problem, I think, with this particular prescription. But most of your patients aren't highly educated. They're regular people. And so recognizing when they write these things down, what these mistakes that they make and so forth, and allowing that to trickle up to the doc. We had when we started trying to put this in place in an outpatient clinic, the docs didn't understand what I wanted them to do. They had very carefully constructed a medical assistant that was now out in the lobby, getting them to complete their PHRs and so forth, fixing it in the electronic record and so forth, so that by the time they got to the clinic, the docs didn't have any clue about what was going wrong. And so we had to help them retool their task so that you could learn from the patient about the world that they live in and the mistakes that they make, and then know exactly how you're supposed to help them. So in 10 minutes, you can't get a lot done. It's not a lot of time. So I would say that if you're starting this, and if they can write down any medication, that would be a good start. Just the name of the medication. It's okay if they spell it wrong. They write it, you don't write it. If they have a pill bottle in with them and they can't come up with any, says, well, you can look at your pill bottle, why don't you take it from there? And again, this tells you, are they health literate in the context of, can they understand the label as it's written? And if they can't do that, that's worth knowing too. And then transcribe it to here as to what they think they're supposed to do. So you can point to where they're supposed to be writing stuff, but the goal would be that they start completing this. It's a frame people who are doing the next step in their care to say, this is what the patient knows and I can work with this. You know, so the big campaign, Know Your Number for cholesterol, was one of those where they started making people aware there was a number that was somehow important, and if it was a high, it was bad, if it was low, it was good. And this is just starting that kind of awareness. And the same goes for blood pressure. Blood pressure has the malady that it's largely an asymptomatic disease until bad things happen. So when you're talking about blood pressure medications, you know, you're talking about knowing a number as opposed to a symptom. So it's again, one of those things about numeracy. Okay. So this is a potent tool for patients to express what they know and how they think about it. Other ways that we use this is we teach our doctors and clinicians to look in these things and start looking at the words that the patient uses and use those words when we talk to patients instead of our own words. So we're teaching our health professionals to become lay literate as opposed to our patients becoming health literate. So you guys as health coaches, you know, are saying, well, the fancy vocabulary you've learned in college, right? Can they understand that? And so one of the things for you to play with as you do this is to think about, can you figure out what words the patients use and use those words in your conversation so that you're actually parroting back for them rather than the other way around.